Welcome back. Trying to get a grip on weight problems in this country. Earlier this month, the American Medical Association officially recognized obesity as a disease, and it could change the future of research and health care relating to the issue. Joining me today is Dr. Tim Faulkenberry of the St. David's Bariatric Program to help explain. Thank you for being here this afternoon.
My pleasure.
So let's talk about now that obesity is classified as a disease. Why did the AMA decide to come out with that now, you think?
Well, I think they found it was important to clarify the fact that obesity is not just a condition. It's not something that is due to a person having poor willpower, lack of control. There are really serious conditions that are directly related to being overweight, significantly overweight. The things that follow, diabetes, high blood pressure, sleep apnea, are detrimental. Heart failure, all obviously very medically significant problems. And then unless you can treat the and that you consider the fact of being so much overweight is the causing factor, you're not really going to get at the root of the problem.
Certainly a slippery slope, obesity is. And now that it's classified as a disease, what does that mean for healthcare treatments, insurance, stuff like that? Well,
hopefully it's going to make insurance more readily available. Heretofore, as an example, heart disease, if you have heart disease and say you have a history of eating rich food and developing hardening of the arteries because your cholesterol has been high, there's been no restriction of having heart surgery, even though you may have somehow contributed to the condition.
Right.
Likewise, obesity is such a prevalent problem, and once people reach a certain stage, they are unable to do anything about it short of seeking medical treatment, and oftentimes that requires surgery. So in order to better understand what's going on with obesity and how it's causing these medical issues, a lot of research will need to be done, more than's been done so far. And the funding of that, I think, is going to improve now that it has been truly designated as a disease process.
And your practice performs some of these surgical procedures because obesity, it's not just diet and exercise that can help this condition sometimes. Is that correct?
That is correct. And matter of fact, diet and exercise is woefully lacking in success in helping people to lose weight and keep it off. Most patients that we see have a history of losing weight several different times and then gaining it back and maybe some more. It is a fact that as one develops this obese condition, that the set point for their standard weight in their body gets higher and higher, and your body will always try to return to that same weight or more after losing weight. Turns out only about 5% of people can lose weight and keep it off by diet and exercise alone once they have reached a level of obesity.
Dr. Tim Faulkenberry with the St. David's Bariatric Program, thanks for joining us today.
My pleasure.